In our interview this week, Dr. Sani Aliyu talks about the largest survey of people living with HIV and AIDS, which will be conducted from June in Nigeria. Dr. Sani Aliyu, you're welcome to the program.
Thank you for having me.
Let's begin by understanding what informed this level of survey, HIV and AIDS survey on a larger scale this time around. This is the first of its kind, am I right?
You're quite right. So the national survey was an idea that came out as a result of similar surveys being done across sub-Saharan Africa. Nigeria is actually the 12th country to have a national AIDS impact indicator survey. And the main reason why we are doing it really is because we need more precise figures, more precise estimates of the number of people with HIV.
What did we have before?
So what we have are crude estimates, if I may put it that way, because the sampling has always been a much smaller sample size, partly because of reasons of cost. And we've also used programming data, so data that we get from testing people in the clinics, etc., to have an idea of the HIV prevalence in an area. But that's really crude, and what you really need are more precise estimates. To have more precise estimates, you need to have a very scientific modeling, a very scientific way of doing it, not only to have a larger sample size, but also the randomization. So randomly how you pick up the populations that you're going to test needs to be very scientific. This is the first time we're doing such a large survey. It's going to be across the country. We'll be testing about 170,000 Nigerians, I think about 70 to 80,000 households across the country. We'll be starting in June this year, and we are actually partnering with the United States government and Global Fund. They're putting in just over $100 million US. By the time we finish the survey, we'll have a more precise idea of where the HIV, people living with HIV are, the number of new infections, and also more importantly, it will tell us how far we've got. Because you remember we talk about the 90-90-90 UN targets, yes, where 90% of those with the disease need to be picked up, 90% need to be on treatment, and 90% of those on treatment need to be biologically suppressed. Well, in Nigeria, we just don't really know how far we've got in terms of the 90-90-90. So this survey will tell us how far we've got in terms of the 90-90-90. And I think it will justify all the money that's been going into the HIV program in the last 10-15 years.
What exactly do you hope to do with this survey?
So this survey will not only tell us the issues about prevalence, where the disease is, etc., where the infections are, but it will also tell us how effective our interventions are. So for instance, there are parts of the country where you'll go and you'll test and you wouldn't find a single positive. There are parts of the country where we have so many HIV services because everybody wants to go there. It's so much easier to get somebody living with HIV in those parts of the country, partly because the prevalence is high. So we need to identify those areas and start moving resources to areas that probably are not covered very well. At the moment, almost 1 in every 3 babies born in the world with HIV is a Nigerian child. We have about 60,000 new infections in children every year, which is quite huge. We know that pregnant women, a lot of our pregnant women with HIV are not accessing health care, particularly antenatal care. We probably have an idea why. It's partly because of the way the health system is structured. A lot of pregnant women, particularly in the rural areas, tend to rely more on traditional birth attendants. They tend to rely more on places of worship rather than going to a health facility. But for us to be able to tackle prevention of mother-to-child transmission issues effectively, we need to have an idea of where these problems are. And we are already working on trying to integrate mother and child health issues with HIV, because you can't really treat HIV alone as a single disease entity. If you really want to have a sustainable program, you need to be able to integrate it into normal health care. So for instance, when it comes to PMTCT, prevention of mother-to-child transmission, what we are working on is trying to get HIV accepted within the antenatal care fold. This is different. Not only are we looking for HIV, we're also looking for hepatitis B and hepatitis C, something that's never been done in this country at all. And as you're probably aware, the amount of funding that's gone into the HIV program in Nigeria has been huge. The US government alone has spent well over $4.3 billion US dollars in the last 15 years on the HIV program in Nigeria. Global Fund have spent well over $1 billion. So it's money that we need to justify what we've used it for. At the moment, we have just over 1 million Nigerians on treatment. And the key question that's always been asked, we talk about 3.2 million Nigerians, but there's always a confidence interval. When we say 3.2 million, we'll give you a range. And that range may be very wide or it may be very narrow. That survey will give us a more narrow range so that we can say to the world, yes,